Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. Hi, everyone. It's Dr. Mehra, the host of the Endo Kids Podcast, and the founder of Endo Kids Concierge. I'm here today with Dr. Waldman, my co-host, and today we're talking about early puberty in girls. And this is a common topic that we see in the clinic all the time, common for us as pediatric endocrinologists to see this. And we're going to do a little bit of a deep dive into causes of early puberty, when you should be concerned as a parent, and what treatment options are available.
Absolutely. So before we talk about early puberty, we need to understand what normal puberty is. And again, we're specifically talking about girls today. When we think about normal puberty in girls, it typically starts somewhere between the age of 8 and 13 years old. And the first sign is breastfeeding. Now, we're not necessarily talking about body odor or hair, really breastfeeding that starts between the ages of 8 and 13.
Yeah. So, when we talk about normal pubertal development, girls usually start breast development around the age of 10. Okay. And then they have a growth spurt between 10 and 12. And most girls, on average, will get their period at 12. Okay. But if you have a child who is having breastfeeding at 9, still considered within the normal range, right? Really, when we're worried, if your child is starting to have signs of puberty before the age of 8. So if you have a 6-year-old who is having breast development, and then you start seeing a growth spurt, well, that's considered early puberty, okay? I want to talk a little bit about body odor and hair. So pubic hair, hair under the arms, acne. So what do you say to patients, Dr. Waldman, when somebody comes in and says, my 6-year-old or 7-year-old is having body odor, but you're not seeing breast development? So what do you say to them?
Perfect. So that's a great question. And most of the time, that's going to be normal, right? Most of the time. Now, there are definitely some times where that is not normal, but usually you will see more than just, say body odor. You might see rapid growth and other things going on at once. But most of the time, that can be normal. And the reason is, so puberty is happening from many different areas. The hair and the smells, we call that adrenarche because those hormones are coming from the adrenal glands. Those are glands that sit on top of the kidneys. And those are different than the hormones that are going to be causing the breastfeeding. And those hormones come from the ovaries.
Yeah. So, oftentimes, we have patients who come into our clinic and they say, my child has body odor or they have hair under their arms, but really they're not having a growth spurt. They are not having, breastfeeding, for girls. And so usually that is what Dr. Waldman said, premature adrenarche. So sometimes these adrenal glands wake up a little bit early. They make a little bit of extra hormone. And some kids are just more sensitive to the effects of these hormones. And, we watch that over time too. So that's not something for you as a parent to say, oh my gosh, is this real puberty or not? We can tell you as pediatric endocrinologists what that means. But just for the purposes of our podcast today, we are really focused more on the early puberty for girls, which is related to breast development and ultimately getting their period. Okay, so red flags for us are breast tissue before the age of 8, very rapid changes in growth, period that starts before the age of 10, okay? So those are things that we're seeing in the clinic, and that's, really when we start to look to see what are the causes of early puberty and early breast development and early menstrual periods.
Absolutely. And when we think about the causes, we really put them in two different categories. The first one is central meaning the brain coming from that pituitary gland. And we've talked about it in other episodes that pituitary is the master of all hormones. And the pituitary is responsible for two particular hormones that are involved in puberty: LH, luteinizing hormone, and FSH, follicle stimulating hormone. And sometimes the brain is the reason, or the pituitary is the reason that these things start early. Now, most of the time in girls, the reason for this central precocious puberty, again, early puberty coming from the brain, is what we call idiopathic. We actually do not know the reason why it started. There's nothing scary, which is probably the most important thing to let parents know.
And, usually it's something that we call idiopathic. So we just don't know why it happens. And usually that's what we see in girls that, they're having some of these signs. So, some thoughts are maybe we're seeing it in girls who have a higher body mass index. So increased weight may trigger it. Maybe there's a history in the family of somebody having early puberty. And often I hear like mom saying, I had early puberty, I had early menstrual periods, and that's usually what we see. People are always asking me, and I don't know if they're asking you, Dr. Waldman, about things in our food, things in the milk, like endocrine disruptors. And I don't really have a good answer for that question because I just don't know. Maybe there is something in our food or in our, plastics or, you know, in certain foods that we consume, but I just don't have the answer for that.
I agree. I do not have the answer. And so when families ask me about it, I tell them to do what's most comfortable for them. If buying organic is comfortable for them and they're able to do that, then that's great. If it is not, then that is absolutely fine too. We want to try to keep our kids as healthy as possible in all different ways. And so, again, doing the best you can as a parent, as a caregiver, is all that we're asking.
Exactly. And so, the reality is most of the time it's idiopathic. I would say 99% of the time that I have seen early puberty in girls, it is idiopathic, and we're talking about central. So we're talking about from the brain. That brain signal just wakes up early and says, it's time for you to go through puberty. And the result is that hormone signal goes to the ovaries for girls. The ovaries make extra estrogen. The estrogen leads to breast development and growth. And then these girls have a period. Okay, so that's sort of the mechanism. And really, when we come into the office, we ask you to sort of tell us a little bit about what the history is. And so, Dr. Waldman, what should patients track for, or what should parents track for pubertal development?
Absolutely. So the history is really, really important when we're talking about growth and puberty. And so for girls, the age at which they noticed the breast started to change, right? When did they first notice what we call breast budding? Sometimes you can feel or see that little pea underneath the nipple. That's kind of the first change. So when did that happen is really important. Along with, when did you notice that clothing sizes changed? Height percentiles, will always ask you or your pediatrician to send us that growth chart, because jumping up in height percentiles might be an indication of something going on with puberty. We certainly might see that. We'll talk about moods and emotions if you've noticed that. Again, there's so many factors that go into that. The timing that you might have noticed body odor, pubic hair, underarm hair. Certainly, we'll ask about the family history. Like you mentioned, a lot of times we'll see potentially a genetic composition. And so if mom had early puberty, we might see that. And then any other exposures. We didn't really talk about peripheral causes of early puberty, but very rarely, but possibly there can be. If the child is exposed to some type of hormones for different reasons, that can also be a cause of early puberty.
Yeah. And, there's rare genetic conditions that also cause that. So, conditions like McCune-Albright syndrome, which we talk about in pediatric endocrinology, but there's rare conditions that are genetic that can lead to early pubertal development. And we as pediatric endocrinologists are trained to look at that. But, from a parent perspective, like what Dr. Waldman said, it's just really, really looking at some of those signs for your child to see if that's really a sign of true early puberty. And we examine that again in the clinic. So if you are unsure, that's important to see a pediatric endocrinologist or even your pediatrician initially to sort of get an initial assessment to see what's going on. But when you come into the office, we do that evaluation and, we will do the growth charts. You will often hear us say, we want to get a bone age on your child. So we say that almost all the time, like a lot of hormone conditions are related to growth. And, puberty obviously is one of them. And so we will do an x-ray of the hand, of the left hand for your child to get a more clear picture as to what's going on. And that gives us some information. And then we do the hormone lab. So we will do some labs to see where this is coming from. Is it coming from the brain? Is it coming just from the ovary? We will do the adrenal labs to look to see if there are excess hormones that are making, increased pubic hair and hair under the arms. We will do thyroid labs too sometimes because the thyroid often, is implicated in a lot of things, but, puberty is one of the rare things that can be related. So early puberty can also be seen by some thyroid conditions. And if we're unsure, we may do an ultrasound from the outside, from the belly, looking at the ovaries and the pelvis to see what's going on there. And so that's part of our initial evaluation, the laboratory information, the x-rays, maybe an ultrasound. And then sometimes we'll recommend an MRI of the brain, especially if we see early signs of puberty before the age of 6 or 7. It's, we're seeing rapid increase in development of breast tissue or, really early onset of menstrual periods. If there's any neurological signs, headaches, vision changes, things like that, we'll recommend that also. So that's basically our workup for this.
Absolutely. And so once we've completed all of that and we get a picture of what's going on, again, like we said earlier, a lot of times this is idiopathic. We're not exactly sure why, but we're very lucky in that we do know how to treat it. We do know how to stop puberty when it is happening at such an early inappropriate age. And so treatment usually consists of what we call a GnRH agonist, or also known as a puberty blocker. Basically, it will stop the estrogen driven changes. It protects height growth overall. It allows more time for emotional development. In the overwhelming majority of cases, a 6-year-old girl should not be getting her period, and it can cause a lot of issues. And so we are able to stop that in a very safe and reversible way.
Yeah. And again, what we're looking at really is we just want to make sure that there's nothing dangerous that's happening. So we talk about treatment for early puberty. After we do the initial evaluation, and sometimes we'll do an MRI just to make sure everything is okay. But I do have some parents who say, we don't want to treat. Like, we don't want to treat our child. We're okay if they get, their period at 9 or 10. What do you say to that?
It's a conversation with every single family. And like you said, there are a lot of families that just want to watch and not treat. And so my job is making sure they understand about what might happen as far as puberty goes, as far as height goes. And if they make the choice not to treat, I support them in every way. My job is to make educated families, educated parents, educated caregivers make sure kids are healthy, they're not in any way in danger, like you said before, and making sure that everyone understands everything we've talked about.
And, the other thing I'd like to have parents understand is that there are a couple reasons to treat. So if you don't want your child to have their period at 8 or 9 even, or puberty starts really early, we treat because psychologically they may not be ready to have their menstrual period. The other thing is that their final height can be compromised. And the reason for that is because kids will go through puberty quickly. They will have a rapid growth spurt. So they may see them as one of the tallest kids in their class in like second or third grade. But then what ultimately happens is they grow really fast and then they end up, stopping growing early. And so maybe at the age of 10 or 11, like we have their final height. And some of these puberty blockers can help with that. And we're not going to guarantee that they're going to gain 5 inches or 6 inches of growth, but that's another reason that sometimes we will treat is if we think that their final height will be compromised because we really want to slow that, estrogen effect on the bone age. So that's an important thing to understand. But I agree with you. I think if parents say, we don't want to give our child this medication, we want nature to take its course and do what it needs to, and everything else is safe and we're not seeing anything, I'm okay with that too. So I think it's important just for parents to understand that these are the options that are available, but you don't have to necessarily take them if you don't want to or you're not comfortable.
Absolutely. And we're also very lucky in that there are many different puberty blockers out on the market right now. And the conversations that we have are about the different options, pros and cons, and, again, working with each family to decide if treatment is right. And if so, which treatment is best for them.
Yeah. And, we can talk on later episodes about the different types of treatment options that are available and see, what's effective for each family. But I think, we do like to offer personalized care for each family just to make sure that they are understanding what they need to for their child's care and treatment. But any final words for, parents who feel overwhelmed with seeing signs of early puberty, especially in their girls? What would you say to them?
Absolutely. The first thing I would tell them is that they're not alone. I think parents feel that way when they notice signs of puberty, whether it's early or even, quote, normal ages. We all feel that way as a parent. Our kids are growing up. I think if they have any questions and concerns, they certainly should contact their pediatrician and pediatric endocrinologist. An evaluation never hurts. A lot of our job is, telling families that things are potentially normal, making them feel comfortable with what's going on with their kids.
Exactly. And if you're really unsure about whether your daughter needs an evaluation for early puberty, you can connect with us at www.endokidsconcierge or, send us a note or a message. But we do see this very often. It's more common than you think. And like Dr. Waldman said, you are not alone when you are, seeing some of these signs. So until next time, thanks for listening, and we will be happy to answer any other questions that you have.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.